Again, thanks for attending. My name is Bonnie Lipton. I'll be moderating today's webinar. I work as a campus prevention specialist at the Suicide Prevention Resource Center, and in this capacity, I provide technical assistance and support to colleges and universities on implementing suicide prevention activities. SPRC is pleased to host this webinar on promoting help-seeking on college campuses. Increasing help-seeking behavior is a key part of the JED Foundation's comprehensive approach to mental health promotion and suicide prevention. But we know that many campuses wonder about the best way to do this. Our webinar today is designed to highlight some promising approaches to support the development of best practices for suicide prevention among college students. By the end of the panel presentations, we hope you'll be able to summarize new research on the barriers and facilitators to help-seeking among suicidal college students, describe ways to engage students and enhance peer networks of support to promote help-seeking, describe ways to promote help-seeking among students at greater risk of suicide, including those who define themselves as gay, bisexual, transgender, and/or questioning, and describe ways to enhance cultural congruence, including utilization of natural support systems and communication in students' first languages. During the presentations, please type any questions you would like to ask the presenters in the question box on the left hand of your screen. Our four presenters have valuable experience working in college mental health, and we're very excited to have them here today. Our presenters are Marilyn Downs from Tufts University, Charlie Morse from Worcester Polytechnical Institute, Amarosa Silva Benuelos and Frankie Flores from University of New Mexico, and Eugenia Curet from the University of Texas Pan American. We'll begin with Marilyn Downs, Director of Outreach at Tufts University Counseling and Mental Health Service. Dr. Downs will be discussing new research on help-seeking among college students. Take it away, Marilyn.
I'm sorry that I can't actually visualize you, so I'm going to try to picture you an audience in front of me since I always find it easier to connect with somebody face-to-face. So I'm going to set the stage here a little bit for us by providing some overview of how to conceptualize help-seeking a little bit theoretically, not too theoretical, but enough to give us some grounding for what we're going to talk about. We'll talk a little bit about some of the research that we know on help-seeking in this population. And then we'll be discussing, I'll be discussing, but all of us will be really discussing applications to campus populations and settings. Since we are all engaged in the kind of work we imagine most of you are, we hope that we'll be able to share with you some of what we've done that we have found helpful. So most of you have probably seen this before, but I think it's a helpful starting point. So when we think about any aspect of suicide prevention, really to remind ourselves that a comprehensive approach is necessary to really tackle this incredibly complicated problem. And in this particular case, we're focusing on this aspect of the approach, the increasing help-seeking component of things, but recognizing it's only a piece of the larger puzzle. So some starting points for us, and really just to provide the rationale for why we know this is important. First of all, we know that only about 1/2 of college students with serious thoughts about suicide receive any kind of mental health services, and that an estimated 80% of students who die by suicide were never seen by their campus mental health services. So obviously there's a vast gap there right away. And I think one of the things that's interesting about our populations is that, you know, we might think that sometimes people don't utilize help because they don't have health insurance, or they don't have finances, or they don't have easy access to resources. And yet in most campus settings, students have easy, free, or low-cost access to low-cost services. So it does pose some interesting questions for us given that. So increasing the rate of help seeking requires, I think, a better understanding of what types of factors might affect students' decisions to seek care, aside from those kind of structural issues of, say, cost or accessibility. So not to be daunted by this, this is a conceptual model of help seeking, and I'll try to orient you to this. So I always think about, anytime we're talking about something like this, we always need to consider that attitudinal and behavioral factors exist within sociocultural contexts. So that is a given across populations and individuals. But when we think about help seeking, we might think this is like a straight line. You know, a person has a problem, they get services. And yet we know that's not the case. Like if you think about yourselves, for example, with something like, you wake up one morning and you have a sore throat. Probably most of the time you don't get right on the phone and call the doctor, right? You wait, you see if it gets better, maybe you take something to make yourself feel a little bit better, and time passes. You're making an appraisal of what kind of problem this is and how serious it is. But maybe if it gets worse or it goes on for several days, then you're going to begin to consider, okay, maybe I should give the doctor a call, and other factors start to come into play. I think a similar set of things happens with mental health concerns. So, a person has to, first of all, recognize that they're having some type of problem. But often a student is going to say, oh, I'm kind of down, maybe I'm just tired, or it's stress, it's not a big deal. But there's some kind of discernment about the type of problem and the severity of the problem. And then there has to be a kind of labeling of it, if you will, as a mental health problem. And not everybody's going to necessarily go there. So that's kind of the first step, that we might think of that as the necessary but not sufficient condition to get help. And then there are other factors. People know about the services available. What are their attitudes about those services? Their personal attitudes. There may be family or peer factors that affect people's attitudes about whether it's acceptable to get help. And then there are kind of social norms and experiences. Do people in my family or community do this? Have I ever done this myself before? Do I have friends who have? That kind of thing. So that's kind of the shape of what we're talking about here. And in this case, I'm really talking about of what we might call formal services, that is like professional help, partners, that kind of thing. And obviously informal help is another important factor here, and other people may be addressing some of that a little bit more than I will. So this is referencing, most of the research I'm going to reference now comes from the Healthy Mind study. Many of you may be familiar with that. It comes out of the University of Michigan. And one of the things that, and I partnered a little bit with Daniel Eisenberg on this particular study. One question that gets asked there is, students are asked, all students are asked, not just suicidal students, but this analysis is actually just among those who are suicidal. Why didn't you get any mental health services this year? And these are the top reasons they named. And this is among those with serious thoughts about suicide. I prefer to deal with issues on my own. That was by far and away the most significant factor for people, the most heavily endorsed factor. Stress is normal in college. I question how serious my needs are. So you see this as kind of discernment. Maybe it's not that big a deal. It's not really a mental health problem. I don't have time. Financial reasons that might get at maybe people don't know the counseling center is free, for example, or that kind of thing. And then other factors, how will people think of me? Is treatment helpful? Maybe the problem's just going to get better by itself. So those were self-reported reasons. But we also looked at, we did some multivariate analysis of other factors here. These are using commonly used measures to look at predictors of treatment use. So these weren't self-reports per se, but measures we looked at. And these are the things that we found that predicted the use of treatment that were associated with using services. Perceiving the need for help. One of the most important factors is somebody has to believe they need help. Makes sense, right? Believing the treatment is actually effective. Contact. Now this is an interesting one. This has to do with, do you know other people who have used services? That goes to that familiarity, family, friends, peers, that kind of thing. Lower levels of personal stigma, what one believes themselves about those who use mental health services. So that was also an important factor. And then knowing about services and how to access them. So we're going to look at these a little bit further. And one of the things that we did on our campus is we took those factors and we tried to essentially translate them into actionable points. But just a couple of other things to say. There were also social influences on the use of counseling. For example, we found that 2/3 of suicidal students say that encouragement from others was a really important reason that they got help. That really bolsters the idea of gatekeeper training. And 90% of suicidal students who did not initiate services on their own said that other people were an important influence. So I think those are things to really bear in mind here. So how do we translate these things? And we were a GLS grantee a few years ago, and so we really tried to deconstruct this and put this into action. Just a little bit about Tufts. We're a private university. We're in the Boston area. Our student body on our main campus here, which is where I'm located, is about 5,000 undergrads and 3,500 grad students, roughly half male and female. And you can see there on the slide the breakdown by race and LGBTQ status, just to tell you a little bit about us. So what do we do here? So along this line of enhancing problem recognition and perceived need, we thought, okay, then we have to really increase people's understanding of signs and symptoms of mental health problems. How do you recognize those? We also implemented some broad universal screening efforts in primary care and online. I'll talk about one of those just in the next slide briefly. Emphasizing this is kind of a health communication point, that mental health problems are common and they're treatable. That kind of softens up that ground a little bit to make it acceptable. And then around increasing awareness and knowledge about services, we really look to promote, we're here, we've tried to make ourselves visible. This is what happens in counseling. This is what you can expect, making it seem a little less foreign and a little less like somebody lying on a couch like you see on television or something like that. Obviously providing services that are competent both clinically and culturally. And then this promoting positive attitudes. So we really tweaked and worked on kind of our our messages, if you will, using social norms messages to correct their ideas about, actually Tufts students have pretty positive attitude about using mental health services, so we really touted that. We were able to tell them, your peers are really okay with this. Highlighting that 1 in 4 students use our counseling services, again, communicates kind of a normative message. Challenging notions that having a mental health problem is a sign of failure. And then, doing this universal message, we all need help sometimes. And then involving our community. And one of the ways we think about this is, promoting helping capacities and thinking about a campus culture of help seeking and help offering. Not just that you need help, but other people need help, and kind of like one can engage all of those things as a member of the community. So some specific things that we did here at Tufts were, obviously, I think most people at this point are thinking about gatekeeper training. We developed our own training, one that is for students and student peer leaders, and another one that's for faculty and staff, so they have some different content and some different stylistic elements. We really tried to become conversant in health communication strategies. What's the way to deliver an effective message, and to use research and reading, et cetera, to become a little more knowledgeable about that. It wasn't something we started out knowing a lot about when we first got our grant. Universal depression screening, this is something we've implemented instead of the typical Depression Awareness Day on our campus. We use the PHQ-9 there. We do the AFSP interactive screening program targeting men in particular. That's an online program. We have an active liaison system with between our staff and a lot of departments. It really gets us out and about on campus, and we do a lot of consultation in the community. And then we really created, just to target, for example, international students, we created some things that really don't read mental health. They read, here's stuff you might want to talk about, and yet it's delivered by staff here, and I think makes us and our services a little more accessible and interesting. Those have been really well attended. And then we collaborate with Active Minds on outreach. So one example of that, and we always think it's important to include student voices, is that we created a film, and I've included the website there. You can take a look at it. We use the Talk Helps tag, and I'll shout out to UW Oshkosh who used that, and we asked if we could use that term, and they said yes, so that was great. And we involve students in this process, and you'll see, again, the messaging that goes in here, and we worked really hard on this. It's normative messaging. It's okay to talk about it. It's okay to tell other people you're having trouble, and that is a really useful thing. And if you don't talk about it, you won't find out other people are going through the same thing. And again, some of these kind of normative counseling messages, you know what? 1 in 4 people get help here every year. It's not that big a deal. So that's a little bit about the film. And so how did this make a difference? We don't know for sure if our efforts specifically made this difference. All we can do is tell you that between 2007 and 2012, we saw this increase in those who knew where to go for services, in people who knew others using services, decreases in the stigma measures, and then most important to us, I think, is the last one, which is among those with a positive screen for depression or anxiety. We went from 39% to 54% of our students using our services within a given year. So that was really our target population. So we've been pleased to see it. Whatever has been happening, that's obviously the direction that we want to be going in. So here's a little bit additional information. Feel free to contact me. And if you're interested in the Healthy Mind study, I think it's a great study. You'll see the contact information there, and you can take a look at that website as well. Okay, I think that's it.
Thank you, Marilyn. We'll now take a question from attendees about your presentation. As a reminder, you can submit questions that you'd like to ask to our presenters in the question box on the left side of your screen. Marilyn, a question we have for you is that you mentioned Active Minds in your presentation. Could you say more about that organization, and how can campuses bring that organization to their school?
Yeah, well, Active Minds, I imagine a lot of people have heard about it, but if you haven't really known about it, it's a great organization. I would suggest take a look at their website, activeminds.org. They've been around for a good 10 years, maybe a little bit longer, started by a woman named Allison Malman following the death of her brother by suicide, and she really got active around, you know what, nobody's talking about this on campuses. Students need to be involved. And so it's a national nonprofit organization that's really devoted to raising awareness around mental health issues, promoting help-seeking, promoting positive attitudes, and really opening up a conversation that often kind of stays behind closed doors. So there are chapters. I think there are 400-something chapters around the country. They're campus-based chapters. You know, often they're student-initiated, but I think if there were an administrator or counselor or whatever who was interested in bringing it to campus, they have ways that they can help you with that as well, and there's lots of great information on their website.
Great. Thank you so much, Marilyn. And I wanted to just let people know, we've gotten a couple of comments about the link for the Healthy Mind study. It looks like they've changed their URL, and it's www.healthymindsnetwork.org. And
thank you.
No, that's fine. And we can send that. You might already see it on the right hand of the screen, or we'll have it in the materials. But thank you so much, Dr. Downs. Next, we'll hear from Charlie Morse, who is the Assistant Dean for Student Development and the Director of Counseling at Worcester Polytechnic Institute in Massachusetts. And Mr. Morse will discuss peer networks as a strategy to promote help seeking. Oh.
Hi, thanks. It's so nice to be here to focus on talking about our Student Support Network program, which was developed with Garrett Lee Smith funding back in 2006 and has continued to evolve past the funding right up till today. It's a program that we continue on our campus. Essentially, it's an extensive gatekeeper training that was built for, and I emphasize with, students. When we started out, it didn't really take on the form that it has now. We asked students for a lot of feedback. We listened to their voices in the training. We responded to things that seemed to work well. And so it's important to say that it really evolved into what it is today. What I hope to do is to give you a brief 10-minute overview of the Student Support Network program that really gives you a flavor for the basic philosophical underpinnings of the program. With the understanding, we developed an extensive manual that we send out freely to any campuses, and at the end of my slides, I'll send you a link to that. So I'm not going to be able to dig into the real details, but want to give you a feel for just how we're coming at this. What we're trying to do is connect within support networks on campus, and that connection theme should come up throughout my slides. It's really foundational to our approach. Our view is that when we, and this was developed and implemented by our counseling center in collaboration with many other offices, but when we get out there and engage students in networks that they're comfortable in on campus, get to know them, help them get to know us, that's going to reduce stigma and that's going to improve help seeking. That's really the philosophical underpinning of it. WPI, it's a science and engineering university, about 6,000 students, 4,000 undergrads, and another 2,000 graduate students. We have about 10% underrepresented students and about 14% international students. So it's a very diverse campus environment here in Massachusetts in the Northeast. It's 70% male and 30% female, which you might see it influences the way that we come at the training. So why students? That's the first question. Why are students important when we're looking at engaging and promoting health seeking? And here's some research that was published in 2009 by David Drum, Chris Brownson. You may be familiar with it. Pertinent to this discussion, I think, is this third bullet that looks at when we ask students, if you have suicidal thoughts, who's the first person you tell? 2/3 of the time, it's a friend or a peer who's the first to know. Our students are on the front lines when it comes to their awareness of their peers' struggles. And what we've found by doing this and training and talking to so many students is oftentimes they feel in significantly over their heads. They're getting that text message at 2 a.m. I'm about to cut myself. What should I do? And they're really at a loss. So we know that students are on the front lines. This is also reinforced in MTVU and Associate Press College poll, which shows that when you ask who do you turn to, it's families and friends. And 77% of the times it's friends that they'll turn to for help, also to parents, but much less to some of these structural resources. With professional school counseling, only 20%, very low number for RAs, and low awareness of a crisis hotline. So we know that students are on the front lines, and the philosophy here is, can we connect with these students and help support them in supporting their friends? Now we start from a place of recognizing no matter what we do, there's naturally occurring networks of student peer support on any campus, on my campus, on yours. It just happens that students do form into networks and do, to some degree or another, want to support each other. These networks can be formal, they can be informal. A good starting point when you're thinking about a program such as this is trying to map out where are the networks of support on my campus. And here's some examples of some of those networks that are formal and informal. We see students coming together in residence halls in terms of their interests, clubs and organizations, athletic teams, Greek life. Some of the less formal, these unofficial interest groups, there are certain areas on campus that students might hang out together and affiliate without having any official cause or designation. So we also look for these areas and try to recognize where are the students coming together, and oftentimes recognizing these overlap. You have several students who are probably involved in several of these networks. And then the thought is, how are we going to connect within these networks? And this is an early question. Who are the key students within these natural networks of support? And so they're student leaders, for sure, students who've kind of risen to official positions of leadership within these organizations, formally or informally. And also we recognize there are natural helpers within our environment. Students who identify, they might say something like, gee, I'm the kind of person that my friends seem to go to for help, probably because they have natural skills in terms of good listening and generally good supportive skills. And when we're recruiting, we ask this question of our campus community. Can you name student leaders who are well networked or natural helpers within our community that might benefit from some training for us in how to recognize and respond to their peers' distress? But we also welcome anybody who's interested. This isn't completely selective. We do recruit and try to cover key networks and get key students in, but anybody's interested can get into the training. So what do we do in the training? We've had great success at sending an email out to these nominated students and saying, hey, Professor Smith said you're a great student support. Are you interested in a 6-week training that's going to help you be better at that? And in overwhelming numbers, students have turned out for this training. And again, we also do general advertising, and we let people know about the SSN program, and they can find their way into it as well. So we have them for 6 weeks, and it's kind of like a class. Our classes here at WPI, they're 50 minutes long, and we put together 6 50-minute sessions that cover key areas that encompass knowledge, skills, perspectives, and connection. So I'll talk a little bit about these areas in a moment. Each of the 6-week trainings are co-led by counseling center staff, or if we're partnering with a key constituent on campus, we'll split up the leadership with them. So you've got someone who's running the group and another kind of content expert that comes in. In this way, all the counseling center staff get to rotate into the training and meet the students, and vice versa, students getting to meet them to form that connection. Some of the key knowledge areas here, and these are the heavy hitters. This is what we see in bulk in college counseling centers. Depression and anxiety constitute a large number of the clinical concerns that come forward. How to recognize friends with depression, anxiety, self-harm and suicide and substance abuse. These are topics that we cover in terms of content, and we also want them to know what are the available resources. How do I access them? How and where should I go for help when I'm struggling, or when a friend of mine is struggling? And also we try to cover, like, when should I be concerned? What are some of the key questions to know when I should be referring a friend into counseling services? Also, we provide skill development. So the first 2/3 of each of the 6 trainings, it's a discussion to flesh out some of those topics. The last third of each training is an experiential piece, which we think is super important. We spend the last third pretty much doing role-playing and to try to develop their empathic responding skills. While that's not the only supportive skill a student might be able to bring to bear in a situation, it's foundational, and we put it out there. If you're doing empathy well, it's far more likely that other things will fall into place. The other skill, though, is we want to help them get oriented to how to help their friends connect with help. They're bound to meet resistance when they make a suggestion that someone should go to the counseling center. So how do you work with that resistance? So we teach basic motivational interviewing skills. Throughout, we're using language that's just very normalized. We stay away from diagnostic clinical language. We normalize that we all struggle in some ways. Sometimes it gets to be more extreme, and it may be diagnosable, but it's more important to look at how's it working out for them. How are they functioning? And this creates a climate where it's not, we're trying to identify those who are mentally ill, it's not us and them, it's us and us. They begin to see the universality of how we all struggle, and we think that breaks down stigma as well. And finally, this theme, enhancing connection. We see them for 6 weeks. We get to know them, and they get to know us personally. And I think that makes them far more comfortable in terms of encouraging their friends to come see someone in counseling. It's also become a feeder system for traditional peer ed. We say, go through the 6-week training, you're in the network, and then there's nothing else you'll have to do. But students in overwhelming numbers after the 6 weeks say, I want to do more. So we can channel them into traditional peer ed, such as Active Minds. Marilyn was talking about that, sexual assault prevention, other types of peer ed, alcohol and other drug abuse prevention. So our peer ed has become more robust as a result of this type of initiative. Some of the outcomes, we train in groups of 15 to 18, and we do about 6 cohorts of training a year. It's quite a commitment, but we train about 100 students a year, and as a result, about 400 students are trained at any given time on our campus. That's 10% of our undergraduate population who has been through the 6-week training, who knows us, and has a sense of connection with us, which I think is a real critical number. So some of the outcomes, they do improve in confidence as outlined here. We've seen significantly increased consultation to us, so students who call or see us or write an email, it says, hey, I have a friend who, and then we begin to converse about how to best support them. And also much better relationships on campus with student organizations. We also see the trainees, we can demonstrate that this training has an impact. They have improved crisis responding skills, personally significant decreases on mental health, help seeking, and improved mental health functioning in terms of psychological flexibility. And this is quite an investment, but this is the kind of feedback we get from students, that it can be life-changing for some students and a life skill for some students. And while it's a huge investment on our part, we think the payback is well worth it. So this, as I promised, SSN is listed as a best practice in the SPRC's best practices registry. The key here is if you want the free manual, it's an 80-page manual. It's got lesson plans and instructions how to do it. Many campuses have taken this manual and set up their own version of SSN. You can just contact us at sdcc@WPI, and we'll just send that right along to you. So that's it for now for me, and thank you so much.
Thank you so much, Mr. Morris. One question submitted we have is, what have been some of the challenges you've faced implementing the Student Support Network model?
Yeah, I think early on we recognized, maybe about 2 years in, we looked at who is making their way into the training, who's actually completing the training, and we noticed that there were 3 groups that we really weren't getting to. One of them was underrepresented students, one of them was international students, and the third was graduate students. Even though we had tried to outreach into these communities, it just didn't seem successful. So one of the things we did was with international students and underrepresented students, we partnered with those offices on campus and created specialized 6-week trainings just for those groups. And that was real successful. Once we made those initial contacts and got into some of the student leaders within those groups, then we started to get a lot more referrals from those students into the general training. One group we did not have success with that same model are graduate students, and we've continued to struggle to involve graduate students in this type of training. They have a hard time making the time commitment. I think the way we've built it, it fits better in the undergraduate calendar. And despite our efforts, we still struggle to connect with graduate students. One other challenge has been, this is a good problem to have, but it's become so popular on campus. Pretty much everyone knows about SSN, and people want in, and we have to wait list because we can only do 6 trainings a year in terms of our infrastructure with 15 to 18. So there's a constant wait list to get into the program, which actually is a good thing. It kind of creates a buzz around it, but I wish we could do more.
Great. Thank you so much, Mr. Morris. Our next speakers are Alma Rosa Silva Banuelos and Frankie Flores. both from the University of New Mexico. Dr. Silva Banuelos is the director of the LGBTQ Resource Center, and Mr. Flores is the coordinator of the Caring at Every Connection program at the LGBTQ Resource Center. Our speakers will be discussing their efforts to increase help-seeking behavior among students at higher risk of suicide with a focus on students who identify as lesbian, gay, bisexual, transgender, and/or questioning.
Hello, everyone. Welcome. Bienvenidos. I am Alma Rosa Silva Banuelos, Director of the LGBTQ Resource Center at the University of New Mexico. And my co-presenter is with me.
My name is Frankie Flores. I am the Caring at Every Connection Coordinator with the UNM LGBTQ Resource Center.
So I wanted to just share a little bit about the University of New Mexico so that we're all on the same page and know a little bit of the demographic at the University of New Mexico. We are located in Albuquerque, New Mexico. We are an HSI, a Hispanic Serving Institute, and our student population is approximately 27,000. And we are a population of non-traditional students, which means we are a commuter campus, but we do have on-campus residence life. And you can see our demographic. Our Hispanic population is around 38%. We have African American, American Indian, Asian, Native Hawaiian. Our white population is about 40%. Our foreign is also our international students. And this is really data that was pulled from the university itself. The one thing to note here is that we are currently not collecting any LGBTQ data, but as a resource center, we are working to improve that so that we can track our students as well as follow up and give support. So next, I want to just go over our learning objectives for our presentations. And as you've heard, we're going to be describing ways to promote help seeking amongst students at greater risk of suicide, including those who identify as lesbian, gay, bisexual, transgender, and/or questioning or queer. You're also going to gain an understanding of basic LGBTQ terminology, as well as understand methods to create LGBTQ peer support and create access to more resources, as well as learn methods to integrate student voices in program and peer support. And Frankie will go ahead and take us through terminology.
So we wanted to give a real quick definition of some of these terms. So we identify lesbian as female-identified individuals who experience attraction to other female-identified individuals. We identify gay as male-identified individuals who experience attractions towards other male-identified individuals. Bisexual as individuals who experience attractions to more than one gender. Transgender as individuals whose gender identity is not congruent with their assigned sex at birth. Questioning refers to individuals who are unsure of either their sexual orientation or gender identity. This may be a phase or also a lifelong identity. And finally, queer. Queer is, as an identity, refers to individuals who do not identify as heterosexual. It is also a reclaimed term that the LGBT community now uses as an umbrella term.
And if you have any clarifying questions, feel free to add them to the side and we'll get to them at the end.
So real quickly, I wanted to mention that at the UNM LGBTQ Resource Center, we make sure to separate gender identity and sexual orientation to ensure that the community at large understands there's a difference between the two. And so what you're seeing here now are stats that are specific towards LGBTQ youth individuals. And so one of the first ones we wanted to show is that LGBTQ youth are 4 times more likely, and questioning youth are 3 times more likely to attempt suicide as their straight peers. Suicide attempts by LGB youth and questioning youth are 4 to 6 times more likely to result in injury, poisoning, or overdose that requires treatment from a doctor or nurse compared to their straight peers. And finally, internalized homophobia and conflict about sexual orientation appears to contribute to suicide risk amongst LGB youth. And these are some stats that we have towards our transgender and gender nonconforming constituents. So 54% of transgender, gender nonconforming, multiracial individuals reported at least one suicide attempt as documented in the report Injustice at Every Turn, which you can actually find on the National Gay and Lesbian Task Force page. Notably, suicide attempts rate suicide attempt rates rose dramatically when teachers were the reported perpetrators. 59% for those harassed or bullied by teachers in K-12 or higher education, 76% amongst those who were physically assaulted by teachers, and 69% amongst those who were sexually assaulted by teachers. There was a prevalence of suicide attempt amongst those who are younger, meaning 18 to 24, which was at 45%, multiracial at 54%, and American Indian or Alaska Native at 56%, or have lower levels of educational attainment, meaning high school or less. And we saw that there was an 18% decrease in suicide attempts for individuals that completed a graduate degree.
So as you can tell, those are some heavy statistics in comparison to some of our previous presenters. So something that we do at the LGBTQ Resource Center is not only look at how to increase help-seeking behavior amongst the LGBTQ community, but really looking at a holistic perspective of the LGBTQ community and how to increase access to resources, networking, and so forth. But before students will even access any of that, what we have found is that we really had to build and develop the LGBTQ visibility on campus. So since we've opened in 2010, we have built annual events each semester to ensure that LGBTQ students, staff, and faculty and our community see themselves represented campus-wide. So as you can see through our campus community, we do a lot of LGBTQ and ally campus events. We do a lot of social networking as well. This is also to build healthy relationships. We use rainbow flags. That's a signifier for LGBTQ community, that may be a safe space, or there are other LGBTQ community there. We do academic support. LGBTQ students do have additional obstacles as students, especially our transgender or gender nonconforming students. We also annually print out what we call the Out and Ally list, which is an opportunity for staff, faculty, and any department to come out as LGBTQ or as an ally of the LGBTQ community. And we print that in our campus newspaper as a visible item on National Coming Out Day. And we also do specific LGBTQ staff and faculty support, so they also feel supported. We also create safe zones across campus, and part of that is educating on LGBTQ issues. The safe zones help build a sense of awareness, safety, and cultural competency across campus. The safe zone trainings are at every department. We also provide LGBTQ 101 and presentations, Transgender 101, and LGBTQ story panels. All of these help build our community as well as create access for ally community to be able to understand us a little better. Some of the other events that we do to show inclusivity on campus is our Rainbow Graduation honoring LGBTQ graduates. We do a UNM Comes Out for Albuquerque Pride. We also celebrate National Coming Out Day, Transgender Day of Remembrance. We do a week of events and end in celebration of transgender lives. We also celebrate the National Trans Visible Day, which is in its second year, and National Day of Silence. And we see that all of these truly help shift our campus climate and culture. And as you've seen, student voices are critical in every aspect of what we do. So once we have the visibility events, this is an entry point in where students can actually connect. They also connect to the Resource Center, which then later they can get involved with student organizations, but more importantly, they find a place they can call home and they find their community. Students are also invited to participate in peer support groups, student organizations, and something we've created called the Queer Voices Roundtable, where students can participate, cross-promote events they're doing, and really just discuss. And one critical item is that we integrate student voices at the beginning of all of our planning to ensure that we have student representation at all levels.
So student staff and other student leaders have been influential in creating groups geared towards specific populations. We have Out Women, which is an LGBTQ specific group. We have Gentlemen's Society, which is a GBTQ group. trans and gender nonconforming group, the queer and trans people of color, and the UNM's Two-Spirit